Kirsten, hello, how are you?
I'm okay.
I looked at Jenny's images. Unfortunately, she suffers from craniosynostosis, as we suspected.
Okay.
Can you tell me a little bit more about Jenny's symptoms?
She cries all the time. I consulted 5 or 6 doctors, but no one really helped. They said I should let her cry, that I shouldn't spoil her, but I was sure something was wrong. She's in a lot of pain.
I'm sorry to hear that. Jenny has the condition craniosynostosis. I'm really impressed at how brave Jenny is. She is a strong child.
That's true, she is. So, what are the options?
Well, my biggest concern right now is reducing what we call intracranial pressure, and we can do that with surgery.
Surgery? That sounds really dangerous. My pediatrician said it could be fixed with a molding helmet.
The molding helmet won't do any good now. Every surgery has several risks, especially head surgeries. Jenny is healthy otherwise, so that reduces many of the risks right there.
Well, I'm just really concerned. I mean, what exactly will the surgery involve?
There are two options. Jenny is 6 months old, so we can do either a minimally invasive procedure or traditional surgery. With the traditional approach, my craniofacial team and I, we make an incision in the head. After that, we adjust the sutures and we then return it to a normal position. In the end, you should not be seeing any incision or scars.
This sounds really difficult.
Unfortunately, yes, it's a big surgery. It can last up to 8 hours. The operation involves the expertise of a number of different specialists working together. Jenny has to be in the hospital for 3 days after that.
If Jenny has this surgery, do we know that she'll be without pain afterwards?
Unfortunately, there's no guarantee that the condition will be completely gone. Some children have some pain that can be managed with medication. In some cases, a child needs to have another surgery, but that's very rare.
Sorry for so many questions. I just want what's best for my daughter, and after all the bad experiences, I want to make sure. So, what about the other procedure, the minimal one?
No worries. It's very important for you to ask questions. With the minimally invasive surgery, we call that endoscopic, and we do that one when the baby is less than 6 months old. That surgery takes an hour. Jenny would have to be in the hospital overnight. She could probably go home the next day, and after that, she would need to wear a helmet for 6 months. We have to check it every 3 months.
Okay. Is the helmet painful?
Don't worry, helmet is not painful. It has to be worn consistently, though. After 6 months, if the growth is not normal, then we have to do the surgery over again, and that's the bigger surgery, but that's very rare.
This is all overwhelming. How do I decide what's best for Jenny?
I'm sure it's overwhelming. There's a lot to consider here.
And you're sure she needs the surgery? The helmet alone won't work?
Unfortunately, she needs the surgery. Plus, if you wait a month, then the minimal procedure won't be an option. You should consider talking to other specialists in the field here, because the more information that you have, the better off you'll feel about it.
Okay.
I'll have my assistant print out a list with the contact details of my colleagues for you.
Thank you. This is very stressful.
I'm sure it's stressful and exhausting. Do you have any family or friends to help you out?
Yeah, my mom.
It's good that you have your mom to talk to for support. Okay, well, are there any other questions I can answer for you?
No, not at the moment.
Okay, well, I think you have a lot of information to consider. You should think about it for a few days, get that second opinion. Let me give you a pamphlet that has information about the craniosynostosis and your options for surgery.
Thank you.
If there are any other questions, again, please just let me know. We'll make a second appointment and we'll deal with those questions then.